Hello, doctors, and welcome once again to this week's Case Law Update. I'm Dr. Chris Rapoff of EZ Continuing Education, and today in the Erb versus County of Los Angeles, we have an appeals board decision on a request by the defendant for a reconsideration of a work compensation judge's original ruling. The defendant contends that the opinions of the neurology specialist AME do not qualify as substantial medical evidence. In this case, we discover yet another way to utilize the Alvarez-Guzman analogy as it pertains to the persistent headaches suffered by the applicant, Mr. Erb, and their relationship to his work duties. The question at hand is, was the AME's argument convincing? Was his permanent impairment rating upheld by the board, or was it struck down? Let's take a look at the case and the AME's approach to the Alvarez-Guzman analysis and let you be the judge. All right, let's get started, but let's provide some factual background. And first of all, in December of 22, the matter proceeded to trial, and there were a number of questions that were posed during the trial, but we're going to address the most important one, which is number one. They indicated that the parts of the body that were injured were the head of Mr. Erb, and it was in the form of headaches. And in addition, he had a sleep disturbance, and that was what was the dispute. So the parties stipulated that the permanent disability rating with the headaches and without headaches would depend upon whether or not the medical reporting of the AME constituted substantial medical evidence. Let's take a look. So during the trial, the workers' compensation judge admitted the report of the neurological AME that was produced in May of 2022. And he concluded it had two diagnoses. Number one, muscle contraction, headache pain, and number two, insomnia. So in his case discussion, the AME stated that Mr. Erb presents with a history of headache pain, which he relates to job stress. He states that he experiences a mild headache 1 to 2 days per month on the average, and severe headaches from 3 to 5 times per year occurring fairly randomly. The headache pain he describes to be related to a constant, ongoing pressure-like sensation in the back of his neck. His mild headaches improve with Advil. However, when he experiences more severe headaches, he utilizes medication and stops what he's doing to relax. On occasion, he has to pull over in his vehicle even to relax when he begins to feel and experience the intense headache pain. They also provide an internal medicine AME, and he also provided a report. And the evaluation noted that Mr. Erb's report of his headaches in both the temporal and occipital areas of the head about once a month, again related to industrial stress. Mr. Erb also reported insomnia. Now this AME's impression were hypertension, GERD, diarrhea, headaches secondary to work-related stress, and insomnia secondary to work-related stress as well. This AME recommended a referral to a neurologist to address Mr. Erb's reported insomnia and his headaches. Finally, he concludes that, quote, Mr. Erb is symptomatic at this time with muscle contraction headache pain. He additionally describes sleep interruption at times of job stress. And it is my opinion that both his muscle contraction headache and his difficulties with sleep interruption are, in all medical probability, related to the job stress, which he describes in a compelling fashion. So as you see, it's very convincing. Let's take a look at the AMA guides, and I'm sure you'll be aware that headaches are not very well considered within the AMA guides, so we are left with some laterality here. In the present case, Mr. Erb's headache pain, this AME decided it was most accurately described by analogy, and they analogized it to the trigeminal neuralgia from table 1311, which we will take a look at here shortly. But the first table in the first impairment describes a 0 to 14% impairment of whole person, And the criteria would be, quote, a mild uncontrolled facial neuralgic pain that may interfere with activities of daily living. So as you see, this AME was trying to, I won't say grasp at straws, but he's trying to analogize what the best rendition would be for Mr. Erb's condition. And also, he concluded in his report that within this class, quote, it is my opinion that Mr. Erb's headache pain is most accurately described as 3% impairment of whole person. So as you see, he had between 0 and 14%, and he chose 3%. Let's open up the AMA guides and take a look. And as you see, table 13, the top table here, 1311, it's a criteria for rating impairment of cranial nerve number 5, the trigeminal nerve. In this case, the AME concluded that class 1 best typified Mr. Erb's condition, which was a mild uncontrolled facial neurologic pain that may interfere with activities of daily living. However, as you see, we have a 0 to 14% impairment of whole person as your range. So he has a lot of physician's discretion and a lot of laterality in determining what actual percentage he chose. He felt that with activities of daily living and their effect, that 3% would be the most appropriate. Now, he also considered, if you remember, the second diagnosis was insomnia. So he went to table 13.4, and that's entitled the criteria for rating impairment due to sleep and arousal disorders. And there are 4 classes here as well. But he concluded that Mr. Erb described the difficulty with sleeplessness. He said it was intermittent and did correspond to the stress on the job. However, he had no evidence of obstructive sleep apnea, and in fact, an Epworth daytime sleepiness scale score of 4 out of 24 points was pretty much well within the normal limits. So he concluded that Mr. Erb's sleep disruption did not rise to a rateable level, as described in 13.4. So for those of you who are following closely, you may ask yourself, well, did he consider Chapter 18 on pain? And in fact, he did, and brought out some good points here. So just to review, the Chapter 18 is the chapter on pain, and it provides the information that enables the physician to understand pain and develop a method to distinguish pain that accompanies illnesses and injuries from pain that have become autonomous processes, and provide the physicians with qualitative method for evaluating permanent impairment due to chronic pain. That's a lot, but that's a quote from Chapter 18. So in his consideration, they said, well, when would you use Chapter 18 for pain as an impairment rating? And the chapter basically indicates that you should use them when an organ and a body system ratings of impairment should be used whenever they adequately capture the actual ADL deficits that the individuals experience. So it sounds like that could work. If you recall, he had a lot of ADL issues with the chronic headaches. But they also indicate when not to use them. And the Chapter 18 states that you should not use the pain-related impairment for any condition that adequately rated on the basis of the body and organ impairment rating systems given in other chapters of the guides. So there you have it. He chose Chapter 13, trigeminal neuralgia, versus using an impairment rating for pain. And he backed up what he had to say. Well, let's examine the significance of the workers' compensation judge's original ruling. When I say how and why, I mean he provided the receipts. Is that the case? Well, in this ruling, they describe the AME's use of Chapter 13 as it relates to trigeminal neuralgia, as we just discussed, and actually why Chapter 18, entitled Pain, he explained why he chose not to use Chapter 18 in the impairment rating of Mr. Erb. The explanation is also a great refresher on when to and when not to use Chapter 18 when providing an impairment rating, strictly on the basis of pain as a criteria for your rating. And also in the original workers' compensation judge's ruling, they stipulated that the applicant, Mr. Erb, while he was employed as a deputy police officer, did sustain industrial injuries to his internal system. They indicated he also had GERD, irritable bowel syndrome, hypertension, head pain in the form of headaches, and sleep during his CT period while he was employed by the defendant, the County of Los Angeles. Now, the court did originally find that the medical opinion by the AME to be substantial medical evidence. There we are. Because the AME's report and his conclusions were not ambiguous, not based on speculation or conjecture, and the opinions were within the doctor's area of expertise. The opinions explained the basis and reasoning for the support of his conclusions, and they found them to be persuasive on his medical issues that were in dispute. And everything was based on reasonable medical probability. Also, the appeals board stated that it was clear that the original judge was presented with no good reason to find the AME's opinion unpersuasive, and the appeals board agreed with the original judge. Secondly, they addressed the defendant's contention that the AME's report failed to support his opinion that the most accurate way to assess Mr. Erb's head injury impairment is by analogy to the guide's rating for trigeminal neuralgia. Specifically, the defendant argued that the report didn't adequately explain the AME's reasons for rating his muscle contraction headaches under Chapter 13 instead of Chapter 18 of the guides. If you do read this ruling and the reconsideration ruling, you'll find that the defendant was totally in error in this case. So in their conclusion, the appeals board stated that they felt that the neuro-AME's report diagnosed the applicant with a muscle contraction headache pain based, of course, as what we mentioned, a mild headache 1 to 2 days per month on average, and severe headache 3 to 5 times per year occurring randomly, without identifying here any related symptomatology, suggesting that the impairment should be rated under Chapter 18, namely excess pain in the context of a verified medical condition, a well-established pain syndrome, or an accompanying associated pain syndrome. That was not the case. And finally, they viewed that the AME's opinion regarding the most accurate way to rate the applicant's impairment to be consistent with Chapter 18's admonition. So the admonition that, quote, an organ or body system ratings of impairment should be used whenever they adequately capture the actual activity of daily living deficits that the individuals experience. Hence, they were persuaded that the AME's report adequately explained its reasons for assessing the applicant's headache pain and the impairment by analogy to the guides for trigeminal neuralgia as indicated in Chapter 13 instead of Chapter 18. And the final conclusion was the petition for the reconsideration by the defendant was denied. Well, doctors, I wanted to thank you once again for joining me this week in the Case Law Update. And in this time, we delved into a case where the grasp of the AME's knowledge and his thorough understanding of the AMA guides was really on exhibit here. Also, this case illustrates that an AME's creativity in his providing the Alvarez-Guzman alternative rating will be upheld so long as you can provide the how and the why in your conclusions, so that it qualifies as substantial medical evidence. I hope you learned a thing or two this week and have a clearer understanding of our role as a QME in the California workers' compensation system, and I look forward to speaking with you again real soon. Until then, take care, and I hope that you continue to prosper and strive to be one of the top QMEs in California. Thank you.